All right, so good morning. My name is Dila, and I have my group members, Luis de Velasco and Cheryl Trau. Okay, this is our ASL presentation, academic learning, service learning presentation. We're here at the DiMaggio Children's Hospital. We presented to a group on Sunday, June 12th, a group of about 5 nurses, and there was also a unit secretary who's pursuing her BSN degree. She was really interested in hearing our presentation. And so basically our presentation, we chose our 2 objectives, which are the first one is the levels of prevention. And also the next objective was the importance of literacy in healthcare. We also took the occasion to talk a little bit to the audience, which was composed of nurses, about the importance of the BSN degree, and they were happy to hear about all the advantages. Slide. Can you move the slide? Next. Okay, so we told them how nowadays it's becoming more important to get the BSN degree because more hospitals are requiring it. Even the ones that don't say that it's mandatory, they usually put on the application that it's preferred. The reasons behind that is because of research that have shown that BSN prepared nurses have better patient outcome. Hospital administrations are really looking at that because they want to decrease cost, and so a lot of them are requiring for 70% of their staff to be BSN prepared, and also because the hospital, healthcare in general is kind of expanding outside of the hospital setting. We need nurses now in the community setting. We need nurses now in outpatient setting, and diverse areas. So now with the bachelor's degree, they're educating nurses to work in different fields and different areas of healthcare instead of just being stuck to the patient care at the hospital. So basically, we went over these points. BSN makes you more knowledgeable in managing care, because now with the BSN degree, they're more willing to hire you in leadership position. Skills to take care of diverse population, like I was saying, different setting, applying technology to nursing, as in, technology is increasing, identify questions for research initiatives, participate in research used for evidence-based practice, because as with the bachelor's degree, you're more aware of the research that's happening around you and why the research is being made, manage chronic illnesses, apply Gene Watson's philosophy and science of caring to nursing practice. So it was a great experience. They really enjoyed that part of the project because it made them more aware of the importance of the BSN in nursing. So now,
yes, we also approach the prevention in healthcare. We have 3 types of preventions. We discuss why prevention is important, and we link the prevention with the 5 most common causes of death in the United States, and the importance of the BSN nurses in the first level of prevention is because in the hospital settings, people that, for example, you have to do a smoking cessation, the personal contact, the nurse with the patient is good when they're gonna decide to stop quitting smoking, but really that contact doesn't tackle the reasons why the person is smoking. That's why community nursing is very important, through advertising, through increasing taxes. So it's a whole range of causes. Now comes, could you pass the next one? We have the secondary and the tertiary levels of prevention. Also.
Okay, so for the secondary level, it's more concerned with detecting a disease before symptoms appear and acts to show or slow the process. So we know that patients like facts. So when you pursue a BSN, you can actually link as far as research as far as helping the patients to understand the different levels of prevention, which also includes like screening for secondary prevention, and then also dealing with the third levels. You're just more equipped when you have a BSN for you to better educate your patients. And actually going back to what Delia was saying before, something that we touched on that the group really didn't know, and through research we found out, is the plan is for the Institute of Medicine. The plan is by the year 2020, they want the workforce to be made up of 80% of BSN students. So actually when we presented that fact, the audience was not even aware of that fact. And one of the issues with why nurses didn't want to pursue the BSN that we found out while we was doing the presentation, that we're going to reflect on and talk about a little bit, is that it has to do with costs. And the audience that we presented to was diverse. We had some newer nurses that's just coming into the field of nursing, and a major issue they had actually was the cost. So with the assistance of the clinical manager that was here during the presentation, we found that actually the Memorial Healthcare System do offer a reimbursement for nurses that want to pursue the BSN. So it's just coming up with more incentives that's going to want nurses to pursue the BSN, because actually the BSN is what's needed right now versus just an associate's degree. Another thing we talked about is healthcare literacy and the impact it can have on treating patients. We know there's different issues as far as healthcare literacy. Once a patient is not comfortable with what they know, it kind of holds the patient back from actually going out and finding the resources that they need or the preventative services. Another issue is the patient doesn't know how to manage their illness, so that makes a negative effect on everything as far as their health. They don't know how to manage. They're not sure what pills they should take, what time they should take the pills, and it's almost like a stigma and shame where they don't want to admit it. So that's another huge issue as far as literacy in Broward County, and that it's experienced on this road with pediatric patients and families. Of course, the rate of hospitalization is increased, because if you don't know how to manage your illness, you're not sure of the measures that you should take so you don't get hospitalized. Another issue is patients do experience a decline in health status. So we just discussed on a whole, and we're reflecting about it on the unit, that they do experience a lot of patients because of the cultural diversity in Florida. A lot of patients do come in that really need help. And one of the incentives that's done here is actually having an interpretation line where the nurses can better educate the patients, and the patients have an opportunity to ask questions. And with the BSN and with research, we just know that education is the key for prevention. So that's one of the things we talked about today.
Okay, and another thing we talked about too that we mentioned is that nursing is one of the fields in healthcare where people are less educated. That's why we want to promote the BSN in nursing to better the image of the profession.
Okay, so to overall talk about our reflection, we had a great experience. Not only did we have an opportunity to teach, but we had an opportunity to engage with the nurses and also receive feedback and give us knowledge of things that we didn't necessarily know. And another area that we was able to touch on for the nurses is just to inform them that the Memorial Healthcare System do actually have a theory, and the theory is based on Gene Watson's theory of philosophy and science of caring. So overall, our reflection, it was a very positive experience.
Okay, that's all, guys.
That's all.
All right, thank you.
Enjoy.